My name is Dr. Sunil Dargar. I have done my MD in pathology and microbiology, being provided to the citizens of Delhi and NCR. How to collect the urine test? Urine is another one of the most frequently prescribed investigations. In urine, generally, we are asked either for a urine routine and microscopic examination or urine for culture sensitivity. It is only infrequently that we ask urine to be checked only for sugar or for ketones generally. Now, one of the most important thing is how to collect urine accurately so that the results that are obtained are without any contamination of any kind, because urine is one of the most frequently contaminated sample, whether we collect it in men or we collect it in women. First, I would describe how to collect urine in men. The best thing in men is that one should have washed itself thoroughly well with plain water. No soap, no antiseptics to be used, and the urine sample has to be collected midstream, which means do not collect the first flush of it, do not collect anything from the last dribble with the preputial skin, which is retracted completely. Same way for women, it's equally important to wash themselves thoroughly well with plain water. No soap, no surfactants to be used, absolutely no ointments, absolutely no powder or any of those things. And again, we simply need to collect a midstream urine, which means do not collect from the first flush, do not collect from the last dribble. From a stream, collect just about 10 to 15 ml of clean catch urine. That serves the best, avoids any chances of contamination and concurrent misreportings that may happen associated with that. See, when the urine report comes in, very frequently we see that there are pus cells in it, which incites a fear reaction. Oh, pus cells, what to do? Is it significant or it is not significant? Sometimes there are granular cast which is written, which again confuses a mind that's reading how significant it is. What does it mean actually? Presence of pus cells in a male urine is very rare. If we collect the urine sample properly, generally there are no pus cells. But if there are anything more than 0 to 1 pus cells per high power field in an uncentrifuged urine sample, it is significant. It simply means look for an inflammatory condition, whether in a prostate or as a cystitis or any reason for genitourinary tract infection. Generally, in cases of severe infections, sometimes even presence of bacteria can be seen under the higher power lens. Now, coming to the granular cast generally means even if we see occasional granular cast in the urine in an uncentrifuged sample, it means it is significant. That means there is some sort of inflammatory condition existing in the renal system, and especially affecting the renal tubular system. When the proteins come in along with some leukocytes get degenerated, enveloped with the protein and form cast along the lines of the tubular anatomy, and they are presented as short granular cast or long granular cast in the urine. But if it is only occasional granular cast, it can be overlooked. But whenever there is a cast that is seen, it is imperative that we request pathologists to do a centrifuge sample and look for the more number of casts, whatever type they are, whether they are cellular or the granular cast, to understand. But the presence of cast means there is a kidney inflammatory disorder. Look into it carefully.